Hello, everybody, and welcome to The Only You, the English version of the podcast Solo Tu. And we're here with Dr. Patino, asking him a little bit about the vaccine and how that's going to be distributed and how it might actually affect, positively or negatively, the Hispanic population.
Welcome, everybody. It's really an honor and a pleasure to be here with you and to have an opportunity to tell you a little bit about what my experience has been and my recommendations. Now, it is kind of unusual now, for a psychiatrist to be talking about vaccines.
Yes, absolutely.
I mean, this is not something that you will normally see. So why me? Why do I want to talk about this? For a number of reasons. One, I want people to be healthy. Second, we want to make sure that people have an understanding of what the vaccine is all about. Right? And I'm not an expert on vaccines, but I'm a physician, so I can talk with some knowledge about how that came out and where the vaccine is at and what are the risks and some of the benefits of that, so people can have an informed decision. At the end of the day, it's always about being informed, that you know what risks you're taking. And I can tell you in general, this is going to be the conversation, I think the benefit hugely outweighs the risk, right? And we'll talk a little more about the details of that. But in general, I think that people need to feel confident that they're doing something good for themselves. We talk a lot about the altruistic part and protecting the rest of the world and whatever. But at the end of the day, you have to protect yourself first.
Absolutely.
I mean, if you don't protect yourself first, you can't protect anybody else, right? So you have to be healthy. So you have to be healthy so you can give yourself to other people. One other concern really, Vince, has to do with how damaging this virus and this illness has been to the mental health of everybody.
Very much so. Even friends of mine who are quite well educated, but not totally informed, seem to have this underlying anxiety and questioning of all the information and the data out there because of misinformation and disinformation. It seems like everyone's driving around in a state of, like we're in our cars, just at that point we're going to have a little bit of road rage if any little thing throws us off. And right now the vaccine is the number one topic about that.
Yeah, and I find it really fascinating because every time I see a patient now, I ask them, are you going to be vaccinated? I always ask a question now because I want to know where people are at when it comes to the decision, right? I mean, for me, it's an easy decision because I've been vaccinated. I got my first dose. I'm getting my next dose next week. 2 weeks after that, I'm 95% covered. So that really takes a weight off your shoulders, right? Because there's a whole chain of events that happens after that in terms of you being safe, feeling more confident, being able to still protecting the rest of the public with your mask, but being able to go out and do things and be more confident at work. Because what we're finding right now is people are feeling very scared.
Absolutely.
Even those who are, and we were talking about this earlier, even those who are against the vaccine, they seem to be paradoxically very scared of the virus. So it's really fascinating to see, as you said, how all this misinformation has led to people having distorted ideas of and politicization of this whole process. When at the end of the day, this is a very simple thing. This is a virus that gives you an illness in which a lot of people can die. And the more people get infected, the more people die. Doesn't mean that everybody's going to die, but we can see that what is happening in California right now. And there are probably some social reasons, how this illness has affected more of the black and brown people. Our people have been affected significantly higher than the rest of the population. And I think that there are issues of poverty. There are issues of, as a nation, there are issues of people living in small spaces with a lot of people sharing this space. And as we've said before, people having to go to work.
Yeah, people don't have the luxury to social distance.
Exactly. And that's particularly problematic with poor people, right? I mean, I would like to say in this country, it's really not as much about race as it is about money,
Yeah.
If you reach
true.
certain status economically, you may not be as neglected, right? Regardless of your race, than if you are poor. And unfortunately, there's a lot of poor people in this country, right? And they're very vulnerable. And unfortunately, people who are vulnerable are overrepresenting about in the group of people who don't want to get the vaccine.
Really?
Yes.
Interesting. Why do you think that is?
Well, I think one is misinformation. The other one is because fear.
Do you think there's some like fear of exposure because they do have to get certified and do things online, and there's a connection to their information or to identity? Is it something like that?
I think that there's some degree of shame of having to ask for help.
Okay.
There's some degree of I'm supposed to be self-sufficient, you know. So, you know, there is some degree of being humbled that is required to submit yourself to the idea that you're vulnerable, right? That I'm not in control of this. So this bravado attitude that you see about I'm not going to let the virus control my life, you know, in some degree is a way of projecting your insecurity. Because it's a lot easier to say I'm in control than to say I'm afraid. And you see it in some of the people that we were talking about, in which they have this bravado attitude, you know, I'm in charge of the virus. Well, you're not. Second, I don't really want you to see my fear. I don't want you to see my vulnerability. And I think that what the virus has done in general is expose our vulnerability. And we as humans hate that.
Oh, yes. I work with that in my other job quite often.
Yeah, so we don't like the idea of I'm not in control, I'm vulnerable, I may get this, you know. And the problem is that that type of thinking actually leads you to take risks that you shouldn't be taking.
In order to prove that.
Exactly. So it's really fascinating to see how people sometimes will say, I'm not going to get the vaccine, but I'm not wearing a mask. Right? So the question is, how are you protecting yourself? And the answer is often, I don't need to protect myself. It's just like the flu. Well, it's not. I mean, we don't even have to have a discussion about how it's not like the flu. You just look at the news and look at the number of people who just said there were like more than 4,000 people died in the United States.
Yeah, but there are people who actually don't accept those numbers.
Well,
And don't accept that news. I mean, that's part of the issue, right? Where the data is coming from, where the information is coming from. I've had people straight up tell me this is not real. None of it is real. And that's hard to deal with it, especially in my case. I've lost friends already from this.
I have lost some friends too. And unfortunately, we get into a very sensitive area in terms of having to define what is delusional and what is not, you know? And you get into very gray areas. As far as I'm concerned, not believing that the virus is real is delusional. But according to the definition of delusion, if enough people believes that, then it's not delusional, which is
It's the accepted reality.
Exactly. So we all have, I mean, even in psychiatry, that's kind of an accepted concept that many of us don't accept. All right. The problem is that when you start getting into that, there are a lot of things in life that people may think about that a large group of people, like in a cult, believe. And in their cult, that's a reality. As far as I'm concerned, it's still delusional, right? So it's very important that we don't treat people who are behaving delusionally, okay, as being a problem, as much as to understand, why do they have to believe that? What need of this individual that delusion serves? What is behind it?
Do you think it's protecting them from the realities of the truth, the fear? By denying it completely, they don't even have to acknowledge any of their fears. They can just say it doesn't exist.
Exactly. But again, that's almost dissociative too, not only delusional, is that we are supposed to have fear for a reason.
Survival mechanism.
Exactly. So if you negate your fear, how is that helping you survive? Right? So we have to have some degree of protection. We have to have some degree of alertness to the dangers, right? Negating the danger doesn't take the danger away. And that's what we're seeing happening right now. And that comes into the vaccine, right? I'm afraid of the vaccine.
Yes, I've heard that a lot. I was literally told by somebody, because I'm taking it as well, if I become a zombie, they're going to shoot me in the head. Those words were literally spoken to me. And it was in jest. However, the point was well taken. They truly think that it's going to do something negative to me as opposed to protect me.
Yes. And when we did the Spanish program last week, we were talking about how we came about the Pfizer vaccine and the Moderna vaccine and how science has evolved over the last 10 years. And people think of it, well, they just came out with it last year. No, this is a work in progress. It's been going on for a while. That has been studied both in animals and in humans, right? And is a very technologically advanced product, right? That is delivering a little piece of code into your body that your body is going to react and protect you against anything that looks like it. So that's the spike of the virus, right? And that's it. That's all it does. It doesn't do anything else. Yeah. I mean, you can argue that the technology has a lot of applications and it can be misused and all kinds of different things. But when it comes to this, right, if you believe that they're putting a substance in your body to control your behavior, well, you have to believe that there's a huge number of people involved in a plot to get you.
Yes, to get you, specifically you.
Exactly. So that's when you start getting into the borders of delusional thinking, right? And again, that is my realm. That's where I work. I work in the delusional thinking process of people who are seriously ill. And I can tell you that you have to be able to listen, right? But it's terribly difficult to convince somebody, okay, who believes that there are aliens controlling your thoughts, that they're not aliens controlling your thoughts, right? So you don't go about it that way, okay? But it's very difficult to be rational with people who don't want to be rational. But we want to capture those who are capable of being rational, who are afraid because of misinformation. And for me, it's particularly important the Hispanic and Black population who are more vulnerable, who are also overrepresenting among those who don't want to get the vaccine, whether it is because of misinformation or because of religion or because of just lack of knowledge. But I think that we need to explain to people that you getting a vaccine is no different than you going to the doctor and getting an antibiotic.
Absolutely.
Every single time we go to the doctor, okay, and the doctor gives us something, we're taking a risk.
Always side effects and all those things.
The benefits, and I always like to present it this way. What is the benefit of the treatment? What is the risk of the treatment? And what is the risk of doing nothing? Because that's really what we're fighting against, right? Yes, if you take a medication for a fever, like Tylenol, there's like a 0.001 likelihood that you're going to get an inflammation of your liver, all right? But people go to the pharmacy and buy Tylenol and never think about that because
don't even read the warnings. Actually.
Exactly, because the risk is tremendously low, right? Well, does this vaccine have side effects? Absolutely. Interestingly enough, the side effects are a reflection of the efficacy, meaning that when you get the vaccine, if you get a little bit of a fever, a little bit of aches, chills, it means that the vaccine is doing what it's supposed to do. It means that your immune system is responding. Okay, so that's why we're not terribly concerned about that. Have there been bad allergic reactions? Yes, but we have bad allergic reactions to antibiotics every day.
Bee stings. Very common things.
Peanuts.
Peanuts.
Right? So every time you eat a peanut, if you have an allergy, you're at risk. Okay? We can expand that to getting into a car and the risk of having an accident. So we have to be able to be provided with information that tells you this is the benefit protecting you from the virus. These are the risks, the most common risks, a little bit of fever maybe, achy, pain at the site of the injection, okay? Extremely rarely an allergic reaction. That's what we know. I mean, out of the, I don't know, thousands and thousands of people, I think there were 4 or 5 reported cases of Bell's palsy, right? Extremely rare. And they don't even know if it's related to the vaccine or it's just the percentage of the population who gets it, right? So we have to be honest, and we have to be respectful of the decisions that people make once they're well informed, right?
But the key is to inform them properly first.
Correct. Because what happens is that then we get upset because they're not getting the vaccine. No. My job as a physician, whether it's treating psychiatric problems or treating a cold or whatever I'm treating, it's not my job to tell people what to do. It's my job to provide them with information that they can make an informed decision, right? And be respectful of their decision. And very often patients are not going to do, more often than we think, they don't do what we tell them to do, right? But if they can't have the information, we have to respect their opinion. Once they're well informed, well, they say, well, I'm going to take my risk. That's fine, right? I mean, I don't think that we need to be necessarily critical of people. I don't think that we need to say you're being inhuman because you're not protecting the rest of the world, right? But that's why when I go to the hospital and I'm talking to my students and talking to the patients and talking to the administration of the hospital, I'm always saying, when we come into the hospital, we have to assume that everybody has COVID. Because I can only control what I do. I can't control what other people do. So if a patient says, after knowing everything you tell me about the vaccine, I'm not going to get it, I'll still going to tell me, I think you should still protect yourself, right? Because you only control what you do. Because the risk of doing nothing is that you can get sick, right? So we sometimes get misdirected, I think, as physicians with this kind of grandiose idea that it's our job to fix things. It is not. It's our job to tell people what the problem is, what the options for treatment is, what the risk of not getting treatment is, and it's the job of the patient to make a decision.
And then part of that isn't them taking responsibility of what may happen for that. If they get sick, it's a little harder to have a little bit of sympathy and empathy for them if they do get sick.
Well, you know, I strongly believe in neutrality. I strongly believe that it's not my job to judge, right? But sometimes it gets complicated. Let's say you walk into the emergency room, okay? You have tummy ache, you've been vomiting, you have a fever, you move to the right side of your body, and the doctor says you have appendicitis. Okay. The doctor says, well, what are the options? Well, you should have your appendix removed, right? And the risk of getting it removed is that you can get bleeding, an infection, okay? Or you can die from the anesthesia. So what is the risk of not removing it? You'll die, right? So in some cases, it's kind of simple, okay? And in some cases, it's not. So what do you do if the patient says, I don't want to have my appendix removed?
You cannot force them.
Well, you could, but that it gets complicated. What happens is that you have to wait until they go unconscious.
Oh, there you go. Yeah.
And then you can get a substitute judgment and get somebody. But that puts him at a huge risk because that may be a rare rupture, infection, all those different things. So again, the vaccine is safe based on the studies we have. The vaccine is effective, right? We have enough evidence of that. And the vaccine is low risk. And you have a huge risk of getting sick without it.
So there's really no excuse at this point, if you're well informed and well educated, other than whatever personal things, to really not take it.
Correct.
Well, thank you very much for the information, Dr. Patino. Hopefully you'll join us for some more info on our new English version of the Solo Tu called The Only You. And we'll look forward to talking to you a little bit more.
Thank you very much. And don't forget to subscribe at Solo2.mx on YouTube and theonlyu.net.